Getting a cancer diagnosis is a life-changing event. For at least 2 million people in America each year, the news leads to appointments taking over the calendar and an overwhelming amount of new information. Dr. Crystal S. Denlinger, the CEO at the National Comprehensive Cancer Network, joins us today to explain how they can help. Good morning.
Good morning. Thank you so much for having me.
Thank you. Thank you for joining us. So, Dr. Denlinger, tell us more about the National Comprehensive Cancer Network.
Sure. The National Comprehensive Cancer Network, or NCCN, is a not-for-profit alliance of 33 leading cancer centers from across the country. Our mission is to define and advance quality, effective, equitable, and accessible cancer care and prevention so that all people can live better lives. And our core work is the continuous updating of NCCN's clinical practice guidelines in oncology, which are developed by multidisciplinary oncology specialists from our member institutions and are based on the best available evidence. And from that derive the NCCN guidelines for patients.
Now, how are the cancer patients' guidelines developed, and what are they based on?
Right. So the NCCN guidelines for patients are based on the clinical practice guidelines and use the same information that the clinical practice guidelines have that our oncology providers trust in making cancer decisions. Once the clinical practice guidelines are developed by our panel of experts, then our health literacy certified writers translate those clinical practice guidelines into easy to understand language with helpful diagrams and pictures, suggestions of questions to ask your doctor, and key information and terminology that someone facing a cancer diagnosis may need. Members of the panel that develop the clinical practice guidelines will then review that information to ensure that it aligns with what the clinical practice guidelines say, and then the guidelines are posted for free for patients and caregivers to use in their cancer journey.
Now, how often are the patient guidelines updated?
So today we are announcing on World Cancer Day that beginning in 2026, our patient guidelines will be updated at least annually on a continuous basis to align with the ever-changing evidence in oncology, and that they'll both be available in English and Spanish. That's more than 70 books providing award-winning, trusted patient information about cancer that can be helpful in making clinical decisions. The guidelines for patients cover information all the way from screening and risk reduction through diagnosis and treatment to supportive care and survivorship, and really span the entire spectrum of information that a patient may need during their treatment.
Now, how can you help raise awareness when a family member is diagnosed with cancer?
Yeah, a diagnosis of cancer is certainly a very scary time, and there may be a lot of questions. So we know that from people who have used the guidelines that they can provide additional information as well as decrease some of the stress and anxiety that comes with a cancer diagnosis. Knowledge can be really powerful. And so when you are faced with a cancer diagnosis yourself, or when a family member or friend may be diagnosed, consider sharing our resources with that person or going online and searching for our resources yourself. These can be found at nccn.org/patients or can be found on our mobile app. There's also the ability to do a print on demand feature on Amazon if you would like to do that as well.
So tell us, where can we go to learn more?
Yeah, so the NCCN website has all of the information. The nccn.org/patients really can provide the direct links to the patient guidelines, but can also provide additional information, including patient webinars and other one-page resources that people can take with them to their doctor. And if you're interested in supporting these resources, which are freely available, you can go to nccn.org/foundation to help support these great resources.
All right. Thank you so much for joining us, Dr. Denlinger, and sharing this important information with us.
Thank you very much for having me.